Patients associate many symptoms with their hiatal hernia, so I went to Google to see what questions are patients asking about hiatal hernia. Let's answer those now. Why hiatal hernias occur. We've discussed this before, so quick review. A hiatal hernia can occur when the stomach slips above the diaphragm into the chest. Your diaphragm is your breathing muscle, and it needs to allow major blood vessels and your esophagus to pass from the chest down into the abdomen. To do so, it has gaps called a hiatus. And when the stomach protrudes up through the esophageal hiatus, a hiatal hernia occurs. This can be because of increased pressure in the abdomen pushing the stomach up, or a larger hiatus or perhaps a loose muscle. For all these reasons, when the stomach protrudes up, you get a hiatal hernia. Why does a hiatal hernia cause GERD? The diaphragm is part of the apparatus that holds the esophagus closed against the contents of the stomach. So when the stomach slips up above the diaphragm, it disrupts that relationship. As a result, stomach contents can freely reflux up into the esophagus and worsen GERD. Why does a hiatal hernia cause shortness of breath? Overall, it's rare that hiatal hernia is going to cause true shortness of breath. Conceivably, such a large hernia can occur that it's actually going to compress the lungs and restrict breathing. Maybe a little bit more often, you can have such a large volume of reflux that it's going to reach up to the larynx and the voice box, and it's going to make it spasm and cause a sense that you're not getting enough air. Overall, though, these are uncommon factors, and really there's a single underlying reason that a person with a hiatal hernia also has shortness of breath, and that can be because of obesity. If a person has obesity, they're much more likely to have a hiatal hernia, and with that, they're much more likely to be deconditioned and have shortness of breath, or they might have a restrictive lung disease because of obesity hypoventilation. Point is, it's not so much that the hiatal hernia caused the shortness of breath, that a common cause of both of these symptoms is the root problem. Why does a hiatal hernia cause chest pain? Because a hiatal hernia causes worsening reflux, one of the chief complaints of a person with GERD is heartburn, chest pain. So very often when a person is having chest pain, that's the type of chest pain that they're having. Now conceivably, and in the medical literature, there are reports of people having such enormous hernias that it actually compresses on the heart and it causes some problems with the heart's function. However, I've seen some really large hiatal hernias where really the entire stomach is up in the chest, and I've not actually seen those people having heart attacks or other dramatic heart problems as a consequence of that. It's actually pretty amazing that the body can accommodate this as well as it does. So overall, if you're having chest pain with a hiatal hernia, this is probably a more innocuous symptom of reflux and not so much a problem of your heart. A caution, however, the same factors that can give a person a hiatal hernia, like obesity, is a definite risk factor for heart disease. And so it's very important that any new chest pain be taken seriously to ensure its origins are not the heart. Why does a hiatal hernia cause bloating? Bloating, in the sense that you get full early during a meal, is a common and frustrating symptom of a hiatal hernia. It probably occurs when a portion of your stomach is trapped within your chest, and that is tight for space. And so when you start eating, it quickly gets filled up, leading to the sense that you're already full. When does a hiatal hernia need to be repaired with surgery? When symptoms are not controlled despite great efforts with lifestyle changes and medications taken appropriately, then a patient deserves relief with consideration of a surgery. Also, if we find that a patient has severe damage to their esophagus, or they have precancerous changes, or a complication like a scar and stricture that's making it difficult to swallow, these are all reasons that would be worth considering having a surgery to get the problem under control. When is a hiatal hernia an emergency? And when is it dangerous? When a large portion of the stomach is trapped within the chest, it risks twisting on itself, a condition called a volvulus. And that sounds like a nasty spell from Harry Potter, but it is a very dangerous condition. When it's twisted on itself, you're going to have enormous pain, nausea, and you're basically going to be vomiting anything that you try to eat, because for practical purposes, food's not going to be able to get down past that twist. The bigger problem is that that is restricting blood supply to the stomach, and so the stomach can start to die. It can have a perforation or a tear. This can lead to an emergent need for surgery. As a GI doctor, I will first try to fix this problem by decompressing the stomach. We can do that by placing a nasogastric tube, which is done at the bedside by placing a suction tube through the nose down into the stomach. Now, at times that cannot be successfully passed by hand, and so we need to do it endoscopically. That also gives me a chance to take a look at the stomach and see if it's still in healthy condition. That's important information for a surgeon who is really going to be the one that ultimately fixes this problem. I hope this video has cleared up some misconceptions around a hiatal hernia and provided you with helpful information to understand the condition. Please subscribe to the channel for future videos on hiatal hernia, some of the surgical options for correcting GERD, and other GI conditions. Thank you and be safe.